if you're dealing with it on your own, it's impossible. It's such it's such a terrible thing that's going to happen to you. You're just going to think the worst. If you've got your family, whether that's wife, partner, or relatives, speaking to other people really benefits. Having them come with you to some of the doctor's appointments. The doctor's appointments are usually not that terrible to sit in, and it's also very important for somebody else to hear what the doctor is saying to you, because very often the kind of white coat syndrome kicks in and you just want to hear everything's fine, and then you stop listening after that. Having somebody else there to ask the questions that you spoke about before you went into the room, they will tend to ask them for you, and it is surprising how many of the questions I fail to ask, even though I'm quite organised, because I just heard you're fine, your scan's fine, and I was lucky my wife comes to a lot of the appointments too. I'm not sure if this is very specific to Scotland, but in Scotland I had a Macmillan nurse at all my appointments for both the oncologist and for the surgeon, so there was some continuity. They're not present in my general doctor's appointments, but having a practice nurse is really important because she's seen it all before and she knows whether the doctor has got it right or not, and it allows you a contact that isn't your oncologist. Sometimes we get a little bit scared to challenge our oncologist because they're keeping us alive. I don't have that relationship with my oncologist. I can email my nurse, who will immediately email the oncologist, and I usually get an answer back within 48 hours of I might feel is a silly question. I'm never led to feel silly, and the answers come back really quickly. So my relationship with my team is more of they're my buddy system rather than my oncologist who's yes and no and terrible news only.